I am a board-certified pediatric endocrinologist and a board-certified pediatrician who practices in Atlanta, Georgia. I came here today to assume, perhaps wrongly, that hormone physiology and physiology of puberty and development is not on the top of your list of knowledge base. And so I'm going to throw some facts out at you. Puberty is a process whereby a young child, immature child, passes through the process of changing their body, changing their bones, changing their organ systems, changing their brain, and changing their physical body to become a reproductive adult. And sex is binary. It is male or it is female. Gender is a concept that was developed as an identification of one's personal self and preference based on how they relate to their environment. It is a psychological basis. There is no test, as Dr. Lappert mentioned, to identify one's gender in terms of a test that is blinded that would give you the information. It is dependent entirely on the opinion of the child. And we are talking here about children, not about adults. Puberty is a process where the body changes on purpose. Puberty blockers are there so that it will not change on purpose and that it can be manipulated with cross-sex hormones to go off in a direction it was not biologically designed to do. In endocrinology, we know what hormones of the wrong sex do to the human body. We know what absence of appropriate hormones do to the human body. And we aggressively treat those conditions. If there's a teenager who is missing the signaling hormones from the brain to go into puberty, it creates a great deal of stress for that patient, both mentally, physically, and that we go ahead and treat that by adding the hormones that belong to their biologic sex to make them essentially medically whole as adults. What we are doing here in the process of this bill is trying to prevent the state of Alabama from allowing physicians to block natural puberty, which is a very important thing, and then on top of that, to add hyperphysiologic, way above normal levels of hormones to create the physical appearance of the opposite sex. No one can change their sex. It is absolutely impossible. Certainly you can change your physical appearance to try to come about a solution to your mental health issues, but that is a harmful thing to do. We as endocrinologists prevent the problems by treating the disease states that create these abnormal hormone levels that do not match the biologic sex. I cannot fathom why we would go ahead and create disease states on purpose when we have no studies to show that it is safe or effective. The reference was made to the professional societies that approve these protocols. These protocols are political agendas driven by ideology. There is basically no admissible science when you actually, Dr. Lappert, the studies that are very low scientific value, and they're actually stated in the Endocrine Society guidelines as having very low or no scientific basis, but a strong personal bias on the part of the committee that wrote those recommendations. So we would like to have this bill forwarded. Thank you very much.